So it's a lot of, it's
So
very intensive.
magnet status is more focused on the nurses and the nurses' comfort, trying to improve the environment. And one technique I use when I go out on consultations is ask the nurses to submit items for their comfort wish list. What would make their job more comfortable? And it can be the way the schedule is done, the way the shifts are arranged, their pension plans, whether or not the facility has daycare or an exercise room, anything like that. They're supposed to think big and small. Little details like having a lunch hour might be on their comfort wish list. But they're encouraged to submit this to the director of nursing or the CNO and see where it goes.
So
it might be a unit initiative, it might be a hospital-wide initiative.
So that really fits in with your theory in the sense that if the providers are comfortable,
Right.
their work outcome should be much improved.
Right. So we look at their health-seeking behaviors. So the health-seeking behaviors of nurses then would be, do they show up for work on time? Do they participate in research? Do they have enough time to do that? Are they healthy? So you look at absenteeism. You look at promotions. And then the institutional outcomes would be retention, overall retention, because that's a huge issue and very costly to replace nurses once they're fully trained. So that's how we would reframe the whole theory to have a nurse focus for magnet status. Now, coming back to the latest change in healthcare, the measurement of patient satisfaction, once again, now we are back to comfort of the patient and the family, because these patient satisfaction surveys, 10 questions, the same questions nationwide, are sent to patients after their discharge. That isn't so focused on nursing. Those items are things like my room was kept clean, I had enough information, I had good pain management. So all of the disciplines are kind of reflected in these 10 questions. So it's really exciting to go on consultations where all of the different hospital workers are involved. And I ask them when we have our sessions together, tell me a story about how you increased the comfort of a patient or family member. So that's been a lot of fun because it acknowledges that their attitude also contributes to patient satisfaction. And so the theory is being used in those ways out in practice. I think I kind of skipped ahead when we were talking about research, but all of this is researchable too, because what I am trying to do is get the data on the patient satisfaction changes as an institutional outcome, looking at the health-seeking behaviors of the nurses, whatever the institution wants to measure, and looking at their comfort on the job with nurse comfort questionnaires. So all of these practice issues then I would like to be able to collect evidence and find out if the theory really does pan out.
Yes. I wish you well on that endeavor.
Thank you.
Because that really is, it's a lovely integrating theory that if you can show that it truly does have an impact, the institution, that verifies your concept of institutional integrity, doesn't it?
Right.